on October 1st. Tell them how this has got to work.
Well, let me give folks just a little bit of background about what's already in place and then what happens on October 1st. When we passed the Affordable Care Act, there were a number of components to it. A big part of it was essentially providing a patient's bill of rights that Americans and advocates have been fighting for decades. So what we wanted to do was make sure if you already have health insurance, that you get a fair deal, that you're being treated well by your insurers. So we prohibited insurance companies from imposing lifetime limits, which oftentimes, if a family member really got sick, they thought they were covered until suddenly they hit that limit, and now they're out hundreds of thousands of dollars with no way of paying. We said to insurance companies, you've got to use at least 80% of your premium that you're receiving on actual health care, not on administrative costs and CEO bonuses. And if you don't, you've got to rebate anything that you spent back to the consumer. So there are millions of Americans who've received rebates. They may not know that they got it because of the Affordable Care Act or quote-unquote ObamaCare, but they're pretty happy to get those rebates back because it made sure that the insurance companies were treating folks fairly. We said that any young person who doesn't have health insurance can stay on their parents' health insurance until they're 26 years old. And as a consequence, what we've seen is steadily the rate of uninsured for young people dropping over the last 3 years since the bill passed. And obviously providing a lot of relief to a lot of parents out there, because a lot of young people, as they've been entering into the job market at a time when jobs are tough to get and oftentimes benefits are slim, this is providing an enormous security until they get more firmly established in the labor market. We provided additional discounts for prescription drugs for seniors under the Medicare program. And so seniors have saved billions of dollars when it comes to their prescription drugs. So there have been, over the last 3 years, a whole array of consumer protections and savings for consumers that result directly from the law that we passed. And for those who say that they want to repeal it, typically when you ask them about, well, what all these various benefits, they say, well, that one's good, and that one's pretty good, and we'd keep that. And you pretty much go down the list, and there's not too much people object to. You will recall also at the time that part of the way that we paid for the health care bill was we said, Medicare's wasting a lot of money without making seniors healthier. And there was a lot of hue and cry about how we were taking money out of Medicare. Well, it turns out that we were right, that we could change how doctors and hospitals and providers were operating, rewarding them for outcomes as opposed to simply how many procedures that they did. You started seeing practices change among millions of providers across the country. Medicare rates have actually slowed in terms of inflation. Seniors have saved money. Folks are healthier. And some of those savings we've been able to use to make sure that people who don't have health insurance get health insurance. Now, this brings me to October 1st. The one part of the Affordable Care Act that required several years to set up, but a critical part, was how do we provide health insurance for individuals who don't get health insurance through the job? It's a historical accident that in this country, health care is attached to employers. And part of the problem is if you're out there shopping for health insurance on your own, you're not part of a big pool. Well, there's no aggregation of risk taking place for the insurers. So they're basically going to say, let's see, you're 50 years old, you got high blood pressure, and we just look at the actuarial tables and we figure you're going to get sick, so we're going to charge you $1,500 a month for health insurance, which the average person has no way of affording, because there's no pooling of risk. So what we said was, we need to set up a mechanism to pool people who currently don't have health insurance, so that they have the same purchasing power, the same leverage that a big company does when they're negotiating with the insurance company. And essentially what we've done is we've created what we're calling marketplaces in every state across the country, where consumers are now able to be part of a big pool. Insurers have to bid, essentially compete for the business of that pool. And what we now have set up are these marketplaces that provide high-quality health care at affordable prices, giving people choices so that they can get the health insurance that they need and they want, and the premiums are significantly lower than what they were able to previously get. I'll take the example of New York State. The insurers put in their bids to participate in these marketplaces. It turns out that their rates are up to 50% lower than what was available previously if you just went on the open market and you tried to get health insurance. 50% lower in this state. California, it's about 33% lower. In my home state, Illinois, they just announced it's about 25% lower. So just by pooling and creating competition so that insurers have to go after people's business the way they go after a group plan, we've drastically reduced premiums and costs. On top of that, what we're now doing is we're saying, if with the better deal that you got, you still can't afford it, we're going to give you tax credits to essentially subsidize your purchase of health insurance. And here's the net result. We'll be continuing to roll out what the actual prices are going to end up being, but I can tell you right now that in many states across the country, if you're, say, a 27-year-old young woman, don't have health insurance, you get on that exchange, you're going to be able to purchase high-quality health insurance for less than the cost of your cell phone bill. And because all the insurers who participate are required to, for example, provide free preventive care, free contraceptive care, that young woman, she may make up what she's spending on premiums just on her monthly use of health care. So this is going to be a good deal for those who don't have health insurance. Those who already have health insurance get better health insurance. And the best part of the whole thing is, because of these changes we initiated in terms of how we're paying providers, healthcare costs have grown, as you pointed out, Mr. President, at the slowest rate in 50 years. We are bending the cost curve and getting at the problems that are creating our deficits in Medicare and Medicaid.
I should point out that so far in most states, one of the good things that